Well, good morning, and thank you for joining our webinar this morning. We're going to be talking about steps to address the public health impact of falls in Iowa, and this is part one. Due to so many of our participants on the webinar, all lines will be muted during the presentation. To submit a question for our presenters, please use the question feature in your GoToWebinar control panel. Janine Moody from the Iowa Public Health Association will be monitoring the submitted questions and pose them to our presenters during the question and answer portion of the webinar. Today's webinar will be recorded and posted along with PowerPoint slides later. A few technical tips for optimizing your webinar experience. Utilize a USB headset. Use wired connection versus wireless if possible. Close all applications on your computer which require large bandwidth. I'm Carly Russell, and I'd like to welcome you to today's webinar. You're in for a real treat. Our speakers will share a wealth of information about fall prevention, and this is part one of a two-part series. Part two is scheduled for May 27th. These fall prevention webinars are made possible by grant funding, and I'm currently serving as that project director. Fall prevention is an important topic. We all have personal stories or know someone who has fallen. So falls are really a big problem. Unfortunately, falls result in more injury-related deaths of older Iowans than deaths from motor vehicle accidents. And you'll hear more about that from Benny. The title of our grant that's supporting these activities is called Building Iowa's Integrated Evidence-Based Fall Prevention Network. And the grant is funded by the Administration on Aging and the Administration on Community Living. Some of the objectives include increase the awareness of the prevention of falls, prevalence of falls, and programs that can reduce falls for adults and adults with disabilities, and increase availability of evidence-based fall prevention programs. And those two objectives will be talked about in today's webinar. The third one, establish a fall risk screening and referral process, will be covered more in part two. Now, let's meet today's presenters. Benny LaHue is an executive officer at the Iowa Department of Public Health. She coordinates programs located in the Office of Disability, Injury, and Violence Prevention and serves as the State Injury Director for Iowa. She was instrumental in starting the Iowa Falls Prevention Coalition. Today, Benny will share data on falls in Iowa. Julie Town is a nurse and has been involved in fall prevention at the local level. She recently attended a grant funding training to become a Matter of Balance master trainer. Julie will be talking about her experiences with community health needs assessment and how fall prevention was identified as a need for their health improvement plan. Mark Hansen has previously served as the Executive Director for the Iowa Association of Area Agencies on Aging, which we call I4A. This aging network specializes in providing services for older adults. His responsibility recently shifted to being a grant administrator for the Fall Prevention Grant under the auspices of I4A. Mark will be sharing information about the 3 evidence-based programs supported by our grant. Dane Gabe is the director of the Iowa Program for Assistive Technology at the Center of Disabilities and Development, a program of the University of Iowa Children's Hospital. Jane is a partner in the Fall Prevention Grant Project. Her interest in fall prevention led her recently to become a master leader in the Matter of Balance program. And Jane will be talking about modifying fall prevention programs for adults with disabilities. And then we'll have questions and answer your questions later. So I think we'll turn this over to Benny now. Oops. We have a tricky mouse that takes a tricky finger.
Okay. Good morning, everyone. We have previously presented on a webinar data for you about falls and wanted to include it on this one particularly because our department was able to update our falls data last fall. And just to give you the context, there are millions of adults aged 65 and older each year who fall in the United States alone. Since falls can cause moderate to severe injuries, such as hip fractures and head traumas, they've been shown to increase the risk of early death. According to the World Health Organization, a fall is an event which results in a person coming to rest unintentionally on the ground or floor or other lower level, and that is the definition we use when looking at our data. While 1 out of 3 older adults falls each year, half of those who fall never report or discuss their falls with a health care provider. So although they are a serious public health problem, many of them are preventable. So this slide shows you the picture of the updated report that was published on the webpage at the Department of Public Health website dedicated to fall prevention, and it is available right now for download if you go to that page on the main page. The sources of data we used for this report are death certificates and hospitalization data. And this has been information we have tried to update every year for your benefit locally and just statewide, especially if you're using it for fall awareness information. This includes numbers by county as well as state rates, so you can look at your own county to compare against others or against state rates. So I'm going to show you on the next 2 slides a screenshot of what those tables look like. You can see here that we've listed by county. These are the total deaths over the 5-year period by county, the death rate, comparing all ages with those 50 to 64 and then 65 and over. And on the last page of each table, you'll see I've circled, you can see the state totals. So you can compare your county death rate with the state rate if that is helpful to you in using the data. So just some key facts I want to cover about this updated report. Sorry, I meant to keep it where it was. So injuries and deaths from falls have risen 20% over the last decade in Iowa. And I will show you on another slide coming up that kind of trend in that on a graph. But again, falls are the leading cause of injury death in those aged 65 and older. Just for context, motor vehicle crashes is the primary cause of injury death among those under 50, but the highest rates are those over the age of 84. And again, as I said, for all age groups, falls are the second leading cause of injury deaths in Iowa, and they have overtaken motor vehicle crashes, which I think is significant for us to be aware of at the department. So when we look at the data from that state report, over the 5-year period, there were 2,229 deaths, or a rate of 14.6 per 100,000 across all age groups. However, if you look at the deaths at different age levels, 182 were among people between 50 to 64, 6.0 per 100,000, and those aged 65 and over had the highest total number, nearly 1,949, or 84.3 deaths. So again, looking at this data, it is critical for us to prevent falls, especially beginning among our 50-year-olds and up, so that we can reduce that risk of death or loss of independence as they get older. This slide is that graph I told you where it shows that increase from 2003 up to 2013. You can see that dramatic increase. And what's important to notice is these are age-adjusted numbers, so these increases are not solely because our Iowa population is aging, but certainly indicate that falls have become more of a risk in Iowa. So the other area we looked at are hospitalizations, and these would be then people who may have shown in an emergency department and then been hospitalized. Over that same 5-year period, there were 54,000 hospitalizations due to falls, and you can see from the rates comparing them that the rate is much higher for those over 65, 17.38 per 1,000 when you compare that with all ages. So again, with this hospitalization we see with age, there is an increased proportion of patients who need care that includes rehabilitation, long-term care, or skilled nursing. The next slide talks about charges, and I'm not going to say anything more than the total was nearly $1.49 billion. What's interesting is that hospitalization rates are higher for those 50 to 64, and those are where our costs are. But for those over 65, it's $95 million. The other thing I just want to show you, and these are not posted yet to our website, but if you're interested, we've prepared slides that show quartiles to see what counties have the lower rank. So this would mean if you're ranked 1 through 25 that you have a lower rate all the way up to the higher rank, which shows you have higher rates of death rates from falls. So we have these tables, or I should say maps, for deaths, hospitalization rates, and hospital charges. And again, we'll get those posted to that web page shortly. The other thing I want to say before I wrap up is to let you know that we do expect to continue updating our falls data every year. It may not be until after September, so this may be the most current data you have, but we will get our 2014 data as soon as possible posted to the web page. Also, we will be issuing a new burden of injury in Iowa report in September, and that will include falls data along with other injury data at the county and state level. And one of the things we are considering in this program is doing a cost-benefit report for the community intervention programs. That will be updated later as that comes out. And that concludes my comments.
We'll move over to Julie.
Sorry about that. One moment while I open this up.
Was that a yes? Did you want me to mute ours?
Yeah.
Okay, welcome everyone. Can you see my screen okay?
Yes, we can see you, Julie. Thank you.
Okay, yeah, thank you. Hi, I'm Julie Town. I am Carroll County's Public Health Coordinator here. As it was stated, I recently took the Master Trainer course for a Matter of Balance and brought to light a lot of information and questions that we had in regards to falls and how it is very preventable. And this just got the conversation going as we are now entering a new China hip year, that this is a conversation that I think counties need to start having and at least talk about it and look at the data and see if this is a problem that they have in their county that is preventable and measurable and can be increased. As we look here, what is a public health problem that is largely preventable? Claimed 25,500 lives in 2013 nationally, cost 2.5 million emergency room visits with more than 734,000 hospitalizations, and what have 1 out of 3 adults ages 65 or older experienced, but less than half have ever told their doctor? Falls. 20 to 30% of people who fall suffer moderate to severe injuries such as lacerations, hip fractures, and head traumas. This is significant, especially since half of these people are not telling anyone about this. But how do falls affect me and my community? This is to get the conversation going. Has your China hip team discussed fall-related injuries or deaths? Direct medical costs of falls in 2013, adjusted for inflation, were $34 billion nationally. Now, we just heard Benny say that just in Iowa alone was $1.49 billion. That means that we have a big percentage of that fall and that cost. If we can reduce that by any, I think we'd be doing our community and our state a world of justice there. What can we do to help reduce the falls? Implement elderly exercise program. Keeping these elderly active in their community and keeping them feeling confident in your community is actually going to reduce your risk of falls. Educate your community on need for medication reviews. Maybe you can speak with your local pharmacists, hold event days that you can put into your China hip plan that would actually be, people can walk in on a certain day to have their medications reviewed. Polypharmacy is a huge cause of falls. A lot of people will go to a cardiologist and then go to their local doctor and then might go see their urologist, and they get prescribed multiple medications without bringing their accurate list in. If people can actually bring in an accurate medication list, have one doctor review it, it's going to reduce the risk for polypharmacy and falls. Also, offer annual eye exams. Maybe you can work locally to see if there is somebody that can do eye exams for underinsured, or make sure people are coming in connection with the right people with Medicare or Medicaid that do offer eye exams, so that visibility and vision are addressed if that is the reason for falls. And perform home risk assessments. This is a real easy thing that we can all help out with. There are forms out there. IDPH has risk assessment forms. They are free. You can call, you can order them, and you can give them to family members. Get the conversation going. Have them bring that into their doctor, their facility, to get that. I think that these are reasonable steps to implement with your China hip, and the conversation starter to at least have with your local organization. And the point I was trying to make today was have the discussion, save a life. If we can reduce any deaths due to falls, at least make an attempt and have the conversation to see if this is a problem that we can improve upon. All the information is on this link here through the CDC that you should be able to get after the program if you have any questions. Thanks.
Okay, we'll be switching over to Mark.
Okay, we're just going to show my screen and start
Slideshow.
Come on.
There we go.
Okay. Good morning, everybody. Thanks so much for participating in this very important topic with us today, taking the steps to address the impacts of falls in Iowa. I'm Mark Hansen, and I'm working with the grant to help develop the evidence-based programs that are available for the communities. I'm working with the Iowa Falls Prevention Coalition, and our mission, and the mission of the Iowa Falls Prevention Coalition, is to foster collaboration between state, community, and healthcare system partners to reduce falls by building awareness and providing education about fall prevention. And our vision is that older adults will have fewer falls and fall-related injuries, maximizing their independence and their quality of life. Our role, if we accept it, is as a community, we play an important role in providing the health and well-being of Iowans. In the U.S., nearly 1/3 of older adults over 65 will experience a fall each year. The good news is, in many cases, falls are preventable. We can reduce falls among older adults by using fall prevention interventions in community settings and help older adults live better, longer lives. There are various risk factors to falls. Falls are not an inevitable consequence of aging, but falls do occur more often among older adults because fall risk factors increase with age and are usually associated with health and aging conditions. I'm going to look at just the basic risk factors.
To the right. To the right.
I'm pushing the button and it's not advancing.
Let's see if it'll work.
There we go. There are biological risk factors, the mobility problems due to muscle weakness or balance problems. There are the chronic health conditions such as arthritis and stroke, vision changes and vision loss, and the loss of sensation in the feet are the biological risk factors. The behavioral risk factors would be inactivity, medication side effects and/or interactions, alcohol use or poor nutrition. And the environmental risk factors would be home and environmental hazards, clutter, poor lighting, no handrails, etc. Incorrect size, type, or use of assisted devices, walkers, canes, crutches, etc. Poorly designed public spaces, as well as weather conditions. There are 3 evidence-based programs that are part of the classes that have been offered and can be offered in your community. The first is A Matter of Balance. This program was originally developed in Boston University, and Maine Health has the license to do the instruction for the A Matter of Balance program. Currently, we have 30 master trainers. 20 were newly trained in March due to this grant. And currently, we have 70 coaches that are taught to teach this program. Between the master trainers and the coaches, we have 43 counties in Iowa now with the opportunity to bring this community-based class to their county. It is an evidence-based falls injury prevention program for older adults. The program targets older adults who have sustained falls in the past, have limited physical activity due to concerns about falling, and are interested in learning more about flexibility, strength, balance, and how to prevent falls. Classes are held twice a week for 4 weeks and are taught by trained leaders in the community. The other thing that I should mention is some master trainers and coaches choose to offer 1 class per week for 8 weeks instead of the twice a week for 4 weeks, but it's an 8-session program. The second evidence-based program, and I'm going to go back to Matter of Balance. This is on a CDC report that you can get from Maine Health, but medical savings for someone that's gone through a Matter of Balance workshop is $290 to $938 per person for someone that's gone through the class, and $517 of that is attributed to hospital savings, $234 to skilled nursing savings, and $81 for home health savings. So $938 per person savings for those that have gone through a Matter of Balance, and that's been documented. The Stepping On program is a program that was originally developed in Australia, and the Wisconsin Institute for Healthy Aging has the license to train the teachers of this program. It is a brand new program to Iowa. 23 individuals were trained at the end of February to offer the Stepping On class for the first time ever in Iowa. It is an evidence-based falls prevention program that empowers older adults to carry out health behaviors that reduce the risk of falling. Community-based workshops are offered once a week for 7 weeks. In a small group setting, participants learn balance exercises and develop specific knowledge and skills to prevent falls. Workshops are highly participative. Mutual support and success builds up participants' confidence in their ability to manage their health behaviors to reduce risk of falling. The 7 weeks bring in a vision expert, a medications management expert, physical training folks, and a safety expert to be guest presenters in the 7-week program. It's been shown through the Journal of Safety Research, a study by Clemenson, fall rate was reduced 31% among stepping on participants. And the third program, evidence-based, is the Tai Chi for arthritis and falls prevention. Tai Chi consists of slow, relaxed movements. Studies show that Tai Chi may improve balance, reduce fear of falling, reduce pain and stress, increase strength, improve functional mobility and flexibility, increase psychological well-being, and reduce the risk of falling. And of course, in matter of balance and in stepping on, one is an 8-week program, one is a 7-week program. Tai Chi is a lifetime program that can be very helpful for those that want to stay. And there is an upcoming class, Tai Chi for arthritis and falls prevention. It is May 16th and 17th. It'll be at the Wise Healthy Living Center, and the registration information is on the screen if you'd like to participate in that. For more information about the fall prevention programs and scheduled workshops, please visit, and you'll see iowaaging.gov/fall prevention. That is where the community classes are listed for all of the trained instructors that are offering falls prevention classes currently in your communities. Leaders from around the state have been trained in matter of balance, stepping on, and Tai Chi. And for additional information about the Iowa Falls Prevention Coalition and availability of leaders to schedule a workshop in your area, you can contact me at the information on the screen. Thank you so much for participating in this webinar today.
There I go.
We'll move over to Dane Gabe, our next presenter.
Good morning, everyone. I'm going to talk very quickly about how you might improve access to any health promotion activity, including fall prevention activities. And I should let you know that this is a real shortened version. I'm going to hit the highlights, but let's get going here. First of all, I think one of the reasons that programs become inaccessible is the idea that persons with disabilities might not be interested or they don't come to these programs. We hear these types of comments frequently. So when we talk about persons with disabilities, who are we talking about? Well, mostly it's very similar to the story from India about 6 blind young boys feeling an elephant and describing it versus by their one point of view, by the tummy or the tail or the trunk or the tusks or the ears. Persons with disabilities can be described in a lot of ways, but let's talk about disabilities under the ADA, describing it as any long-term, so it doesn't count for a broken leg, any long-term mental or physical impairment that substantially limits one or more major life activities. And as you can see from the list, that the elephant then does become a lot of different possibility things and maybe a combination of many things. And since that's why we have kind of a picture of a broken up elephant if we stay with that analogy. So it could be walking, speaking, seeing, breathing, eating, sleeping, their ability to learn or to take in knowledge, caring oneself, performing manual tasks, or even working. It's important to realize that when we talk about including people with persons' disabilities, we're often also talking about the aging population. Disabilities increase with age. And so those same lists of long-term impairments, if you can relate to common aging conditions like arthritis or Parkinson's or cardio conditions, stroke, somebody might be aging or younger and have a hearing impairment due to farm or military work histories. It could be their diabetics or cataracts, macular degeneration for seeing. Someone may be limited on their life functions because of breathing. Yes, they are older, but they have congestive heart failure or COPD. Then you can see from the list that there's all kinds of conditions that we associate with aging, but they also are associated with having a disability, or that it might occur to any of the above conditions. So there are common barriers to trainings for persons with disabilities that drive them away or they don't attend. That common perception: lack of marketing, transportation, time of day, physical access to and around the building, the speaker presentation itself, and the materials. If you can reduce those common barriers, people with disabilities will attend, they will participate, and gain the benefits. The quickest way to learn about this in a larger than just this presentation, if you just Google Plan Accessible Event, you will become several state departments of public health, disability organizations have documents to help step you through this. And I'm just going to hit the highlights of those things, and they'll give you more resource sources if you Google it and go into one of those. But one of the main things that they are going to say is a plan for it and to make it accessible ahead of time so it's ready to be used and participation by persons with disabilities. The second big tip will be at the point of registration asking what accommodations will you need. So for the first one, overcoming marketing barriers. Persons with disabilities often do not get the type of marketing that you are putting out possibly for older populations. They may not get the newspaper, posters in the usual places like Meals on Wheels or aging centers, places like that are not going to reach them. To reach that market of persons with disabilities who are living in the community, you want to connect with your county case managers, assisted living complexes where they are living, connecting with community disability service providers who provide supported community living or group homes or disability employment services. And then support groups that are in your community for like the ARC, or Arthritis, Parkinson's, multiple sclerosis. If you're unsure of what those are in your county, you can call Iowa Compass at 1-800-779-2001 and they can help identify those for you. Overcoming transportation barriers. They can't get to where the training is. Well, first consider the schedule of the public transportation times and locations and keep that in mind. So if they need to use public transportation, it's close by and that it's related to when public transportation would get them to that site. You could also coordinate with paratransit services or community living services that provide transportation. And you might need to work around their heavy use times. So when they are serving their clients and getting them to work or back home from work, those are hard times to get those support services to provide transportation for persons with disabilities to your training. Overcoming time of day barriers. Remembering that persons with disabilities may need a little bit more time in the morning for their self-care, so starting too early in the morning makes it impossible for them to get there, plus sometimes the transportation on top of that. And that they may have, transportation may not be available at all in the evening or on weekends, or that it's available only on a very limited basis at the start or the finish of the day because of other commitments. Overcoming physical barriers. Somebody has to get in the building and around the building. So in this case, the elephant's marching down very independently down the big wide hallway of a school building. The Plan Accessible event that you are going to Google and find about will provide you links or the survey itself to look at the location that you're planning to see if indeed it is going to be usable. It's going to look at parking, the front door, the route in and around to get to the room, signage, the restroom, things like that. Overcoming speaker presentation barriers. Again, by asking at the registration process, what accommodations do you need? That will give you plenty of time to arrange for an ASL interpreter. And again, more information can be provided by Iowa Compass about how you call or get that done. And talk to your presenters or yourself about how to make accessible presentation, which actually helps everybody. Make sure that the language is clear and direct at around a 6th grade level. Describe the overhead. So for instance, I'm going to explain that in this case, the elephant is now in the classroom along with everybody else, and you have to make it so they can hear, absorb, and use the information. Amplification might be needed for someone who is hard of hearing, and that could be one-on-one or room amplification. There might be a need for more breaks to do a personal care or because of possible fatigue. Overcoming materials barriers. So most of these trainings have a very nice little booklet. Again, asking upon registration, you'd be able to have those materials available at the same time. Not at the second class, not at the third class when they're being handed out. They might request an alternative format, and those could be large print, which means 16 font, or 18 is even better. They might request that the workbook be provided in an audio form, either an audio tape or an MP3, or that it's available online and they can just download it, or it could be provided in Braille. They also might ask that it's an electronic copy that they can get online, or they're given a USB or a CDD, sorry, wrong thing there, that they can then have the electronic copy read to them by their software. Then they might not need it in Braille, which can be pretty expensive and timely to get done. But again, their preference about how they can get to the material that you thought was important enough to hand a workbook out to everybody else. In general, these types of things will help everyone. Think about your workbook and your materials being printed in a sans serif without a tail. So those are after yes, you'll see that visually there are no tails. This is easier to see, clearer. The not ones, Times New Roman, Blackadder, Bradley Hand, have tails on the letters. It's harder, it's confusing. And think about handouts or slides that have pictures and a lot of white space. So that is very quickly how to improve. And there, again, from the beginning, you can call Iowa Compass, or from my information on the slide, I'd be happy to answer about other materials and get them to you. So I think we're ready to go on to the panel. Questions?
Okay. Thank you, Dane.
We're now ready for a few questions to respond to the attendee. We have a few minutes to answer questions. Remember to submit your questions during this time in the GoToWebinar control panel.
Okay, we do have a few questions. We can get started here. The first question is from Amy Lepowski at Lynn County Public Health. Okay, slide this around the microphone today. Thank you. And the first question we have is, are there any plans for additional training, specifically the Stepping On course?
I'll take that one. The first year of the grant allowed for us to bring in the Wisconsin Institute for Healthy Aging and to train 20 people or 10 teams of trainers. They actually allowed us to train 11 teams of trainers, and I was number 23, so I'm actually stepping on a leader trained myself. But the requirements of the grant and the requirements of the program are such that it takes 2 stepping on leaders to offer the program for the first time. We wanted those teams to conduct 2 community classes, and once those trainers have done those 2 classes, then they've got the opportunity to take additional education to then be able to teach other coaches or secondary individuals. The one thing that I would point you to is that of the 11 teams of trainers that are out there that are beginning to run community classes, if one is in your region, if an older adult takes the class and is a participant in the class, let's say an ex-educator, an ex-nurse, someone that's over 65, they can become a peer leader for the program. If a peer leader is developed within your community, then it takes only one trained teacher along with the peer leader to offer the class. So that's an opportunity to broaden that expansion a little bit instead of 2 of the trained teachers. But this is the first year of the program. The 23 instructors were just trained the end of February, and they're beginning to offer their requirement, which is the community class, prior to August 31st. So the answer in a long way is, over time, the Stepping On program can be developed more broadly and developed again in Iowa. But I also should say that you can contact the Institute for Healthy Aging in Wisconsin, you could attend the training that they would offer in other places to become a trainer, but it's not going to be grant funded. That would be covered by your agency, and I believe the cost is about $1,500 plus expenses for that training.
Thanks, Mark. And then Amy, I hope that next question, but I'll just put it out there just in case. The question follow-up to that is, what's the approximate associated cost for conducting the different programs? Do you think you addressed that?
Well, no, that was the cost of training, but the associated cost is certainly marketing. It depending upon whether or not you've got any rental charges or not, whether or not you provide snacks, usually for the 7-week or the 8-week program. Whether or not you want to charge for the time of your teachers and the development of the program. There are certainly costs to provide it, but we're also trying to make sure that the communities have the tools available to offer for older adults. And really for both Matter of Balance and Stepping On, the goal is not to have a parent-child relationship or a professor-student relationship. It is a facilitated discussion with older adults on some of those risk factors so that they, in their way, will change their habits and look at their homes and look at their medical conditions and look at the weather-related risk factors and help change their behaviors. So by having the knowledge, you can help change some of those risk factors even by not necessarily being a community-based teacher at this time.
This is Carlene. I would also add that since these are evidence-based programs, they do have a curriculum or a manual that you follow, and so there's a participant material that there would be a printing cost.
Okay, then we have another question. This one comes from Jane Condon at Calhoun County Public Health, and Jane asks, does anyone have experience using a pharmacist for med reviews as part of the risk assessment, I'm assuming?
Well, I don't have experience with it, but I'm going to mention this to you. I've got 2 pharmacists that are willing to do a breakout session at the Falls seminar that we're going to hold July 10th in Waterloo. And one is, I don't have the notes in front of me, but I've got 2 pharmacists that have been recommended by the Iowa Pharmacists Association that are going to spend some time talking about medications management and effects on older adults. The one pharmacist works with Blue Care. That is one that I do remember. The other is an advising pharmacist for about 30 long-term care establishments around Iowa, and both are willing to come and present medications and how they would affect falls.
And this is Minnie, and I'll just jump in because last fall in 2014 when we were doing Falls Prevention Awareness Month, Hy-Vee pharmacists kind of partnered with our Advisory Council on Brain Injuries, and they were offering kind of counseling if you were a patient of theirs. And my guess would be if you would just talk to pharmacists in your area, you might find that they are comfortable looking for medications that might interact to affect balance, et cetera. But I think that Mark's point is very well made, that actually coming to a breakout at that symposium will help give you more information about what we're looking for or what you should look for with a pharmacist.
Okay, thank you. And just as a follow-up to that, Jane's asking, and has the registration process been sent out for the July symposium? We will have a slide on that in a minute, Jane, but I'm going to let Carlene.
But we're still in the planning process, and we have not sent out a registration process yet.
But save the date.
Yeah.
Save the date. Okay. We have another question from Marsha Blaine. And Jane, I think this would be for you, so your mic is open. You can respond. Could somebody please post, I can post it if you give it, the contact information for Iowa Compass?
I'll type it in the chat form.
Thank you.
But it's 1-800-779-2001.
Great. So look for that popping up in the chat window. Can you say that one more time, Jane?
1-800-779-2001.
Okay, thank you. So I'm going to send a last call for questions here if people want to continue submitting those, and just go around Oh, I'm sorry. Jane's asking, and the date for the symposium is?
July 10th.
July 10th, and it's in Marshalltown.
We're going to Waterloo. We're going to be going to Waterloo.
Sorry.
It's at Hawkeye Community College in Waterloo.
Yeah.
It's a one-day event. It'll be from 9 in the morning till 5 o'clock.
Yeah.
Plan a full day, and we'd love to have you. Mark it on your calendar now. We're going to...
Let's put that slide up right
sorry.
now, Arlene.
Oh,
and let's
get it here. No.
Okay, go ahead and put that slide up.
Does it go to yours?
Yeah,
like
Come
yours?
to that.
Out here.
That save the date is also posted on the IPHA events calendar.
There.
We'll go one more,
One more slide?
Yeah.
and we'll come back to this. Any other questions, or do any of our panelists have anything final to add?
Okay.
Oh, and Janine Abrams is on and says, I'm a pharmacist and we love reviewing medication.
Oh, good.
Yeah.
Where are you located? Can you, she's in Iowa City.
Great, great.
I know that when our communities had health fairs, we've invited pharmacists from the Drake University Pharmacy School, and I think there are people who are very willing to come to a health fair if you're sponsoring that in your county.
And Janine points out that pharmacy students are a great resource as well.
Great.
Okay, excellent.
So we do invite you to join us for on Wednesday. I'm going to go exact. Okay, Wednesday, the May 22nd, to the part 2 of our webinar. And during this session, we'll be looking more at the STEADY toolkit, using across the continuum how you can assess and refer. We'll be talking some about Medicare coverage for fall prevention services, and we'll also present how to establish partnerships for fall risk screening and referral to the community programs. And the registration information will be out shortly, so you'll hear about that.
Okay, we don't have any other questions coming in, so I think we're ready to
Okay,
wrap up.
one more.
When we go back to one more forward this way.
Yeah, we'll go back there. So we want to thank you for joining us in the webinar today. And you will be directed to a brief evaluation of this session, and we would appreciate your feedback. The feedback will be very important for our grant and the reports that we need to submit. The grant has been awarded to the Iowa Department on Aging, and so I'll have to develop those reports. So please look back at that evaluation. An audio recording and slides will be made available as well. And if you have any questions regarding today's session, you can contact me, and my contact information is on the slide. So we thank you very much and hope that you have a great day.